Good morning, everyone. Thank you for joining me. Allow me to introduce myself. My name is Georgie Gould, and I'm the Project Assistant at Global Community Resourcing. I'm pleased to be the moderator for today's webinar, the focus of which is StepUp for Dementia Research, a one-stop shop that connects individuals both with and without dementia with research. Our webinar today is facilitated by Global Community Resourcing for the Community Care Smart Assistive Technology Collaborative. Global Community Resourcing has extensive international linkages, and we have been fortunate enough to work on many international projects and research entities. If you have joined us for previous webinars, you'll know that they are designed from feedback and requests we received through the collaborative. The focus of our webinars is to bring together local, national and international perspectives in research and development, as well as deployment of smart assistive technology in the community care sector. Just a reminder that if you haven't formally registered at the collaborative site, it is accessible to all and free to register. Please visit www.satcommunity.com.au to register now. Please note that Global Community Resourcing are not promoting or endorsing any particular product, research, identity or organisation. The purpose of our webinars is to serve and inform viewers of various smart assistive technologies currently in development or deployment. In this webinar, Professor Jeon will present an overview of her StepUp for Dementia Research and will explore the functionalities for volunteers and researchers as well as its progress to date. This is the Professor's second time on the Community Care Smart Assistive Technology Collaborative, and I'd like to welcome back the Professor. Take it away, Professor, for today's webinar.
Thank you, Georgie. Good morning. This is Jeon from the University of Sydney, and it's my absolute pleasure to be able to provide you with progress and updates and our next step for StepUp for Dementia Research. So StepUp for Dementia Research was funded by the Australian Government Department of Health under the Dementia and Aged Care Services Fund in 2018. I have been working with international collaborators from UCL, Professor Martin Rosser, Adam Smith, and Piers Cotting from the University of Exeter. And I have team members working with me here. Now, let me just start with, why we began this service in Australia. And as many of you are aware that dementia is a global issue, and in Australia we have approximately 447,000 people living with dementia. And dementia is a chronic condition, but it's also a leading cause of death for women and second leading cause of death for men. And it's estimated about 250 new cases of dementia each day. And what we also need to be mindful is almost 1.5 million people are involved in the care of someone living with dementia. So with dementia's, increasing prevalence, the government, started putting major funding for dementia research. They started in 2015 and promised $200 million for dementia research. So we are seeing more dementia researchers working in this area, looking for people who want to participate in dementia research. Now, dementia research is, playing a major role in advancing not just science, but also improving our care and quality of life for people living with dementia. If you look at these slides, a global action plan on the public health response to dementia, and it clearly indicates the significant role that research plays. So if you look at the 7 action areas and targets, and the first action area looks at by 2025, 75% countries have national policies and strategies and plans or frameworks for dementia. And the second action area looks at, awareness, public awareness. The third one is about risk reduction. and so on. If you look at the seventh, that actually talks about global research output, and they actually, the plan is to, improve, double the output of dementia research. by 2025. It's quite ambitious. But what it actually tells us is that, whether we are talking about policies and the care and service delivery, what underpins is research evidence. And so the role of research that plays in supporting people living with dementia and their families is very important. Now, in doing this, what we really want to highlight is that, research plays, as I said, research plays a major role, but research needs a lot of support from the public as well. And as you may have come across this report, the latest report done by Alzheimer's Disease International, they surveyed about 70,000 people around the globe that covers across 155 countries. And they actually, found out the stigma that's actually embedded in dementia is still very real. And a lot of people are reluctant to talk about dementia. Public are, the members of the public are very concerned. About 80% of people, participate in the survey are worried that they may, get dementia at some point in their life. So the concern is real, but at the same time, it's not a condition that people easily talk about, and that impact that has on our service delivery, and as well as, when we conduct research, that, becomes a real issue. So if you, have a chance, have a look at this report, and if you look at, particular chapter 5, it actually talks about, why, we need to tackle stigma, because that is actually impacting on, the way that we conduct research, and also then that impacts on how we deliver our, service in the end. Because when people are reluctant to participate in research, it actually takes a longer time for researchers to conduct research. And then sometimes people are unable to finish their the studies within a timeline. So, people want to find a cure, and we need to find the cure. But in the interim, we need to encourage and facilitate research participation, because that leads to hope, and that increases awareness. Awareness tackles stigma. And it's a kind of a cycle that, it's almost like we can't really say one, which one is first, but that, stigma and the research participation and, having hope, they all, fit into each other. So I just, share some of the stories that we know of. Wendy Mitchell, she was diagnosed with young onset dementia in 2014, and she was 58 at the time. And she is a very well-known advocate in the UK. And she actually currently, she gives lectures to new staff member in NHS in the UK, and she actually wrote about this, her view of research and the role of healthcare professionals. So she says, you may be, because when she gives a lecture, this is what she tells other people. You may be sat there thinking, well, what's research got to do with me? It's not part of my job. But we have to normalize talking about research, and to do this, we must have every healthcare professional, no matter what their job, to come on board and promote research. And I think, then she talks about, research providing that kind of hope. And it's not just Wendy, that I have come across a lot of research participants in my own research, that people talking about being able to contribute, supporting other people, even if the particular research project itself is not able to help them directly. They feel that, being part of research, they feel that they're contributing to, creating hope. So it's really important from the, the perspective of the person living with dementia. And Jane Thompson is, former carer, and she also talks about, how important it was, for her to be able to start being part of research, not just the research participants, but also, being able to be involved in research. Sometimes she participates as a member of committee or a group of, expert group that, that shares her experience with other people. And she says, she wished that she had known about opportunities to participate in research when she was caring for her husband, but no one approached them to do this. So I think it highlights that people, even if they want to do something about it, there isn't an easy way for them to go to. And it's something that, sometimes people find out by luck or, so I think it really tells us that we still need a lot of, education about what opportunities are available if someone is interested in dementia research. And Dennis Frost is another person that that we work with, and he also has a young onset dementia. He's a very active member of our public involvement panel for our StepUp, and he says the hardest thing about research is locating it. Often you have to rely on word of mouth to get connected, and that's again his kind of initial challenge. Now everyone knows Dennis, and therefore he often gets invitation from variety of research project teams. But I think at the beginning that was a difficult process. Imelda Gilmore, she's also a former carer, and she talked about the value that that she experienced when she found out that she could do, how she could contribute, and then she said, enthralling and exhilarating, and they're the kind of words that she used in terms of how she, was able to be part of research, and I think sometimes people feel that it's just I've got too many things to do. I've got too many things, to look after. I can't think of research. Of course, this, being part of research or being involved in research is not just for everyone. It's not for any time. There are times people need to do other things, but there are times, people wanted to contribute to research. So these are the kind of examples that I've shared. So, so this is the kind of leading to this slide about from the public perspective, recruiting study participants is costly, time consuming and challenging. But, when that's more from the research perspective, but public perspective, there is limited support available to facilitate a broader public engagement in dementia research. And until, we came, to exist, there was no systematic way or one place to go to find out about dementia research. So as I mentioned, the stigma is still very real, and also a lot of what we do in our research, we are not actually, inclusive, not because we don't want to. Often it's harder to reach out to those, communities. It could be rural areas and communities with different, language background. So what we really want to do is that we need to find a way to bring the public to a place where people can easily access dementia research. So, then if you look at the institutional researchers' perspective, when there are delays in finding the right people for studies, lead to investigators we burnt out, low morale among study team members, funding extensions for study delivery, and it's often necessary if we can't do the study in time, in a timely manner, and if we don't have enough numbers of people, then whatever we have may not have valid voice in terms of reporting to a scientific community, and something that's considered as rigorous evidence, we may not be able to do that. So so in the end, there are, consequences, because, as a result, and, all these delays and that could actually limit the timeliness and effectiveness of research and evaluation. And ultimately, it slows down therapy development and derail the national goal, the action plans that we saw earlier. So the recruitment challenge is real, and it is, highly costly when, studies are delayed, but also it delays the whole development of, therapy. And if we were looking at, ways to improve care and services, we want to actually inform the service service providers and the governments and policymakers to be able to hear about what the public thinks or experience in a timely manner. But when the recruitment is delayed, then whatever the information that researchers come up may not be actually, useful any longer. So there are lots of different implications, and we wanted to tackle this. And as I said, this is not just the issue that we face in Australia, it's a global issue. And so about 5 years ago, the UK government started a new initiative called the Joint Dementia Research. And so our StepUp for Dementia Research is modeled after Joint Dementia Research. And they are still very successfully, running this program. About 45,000 volunteers are currently registered in Joint Dementia Research. So, so our UK collaborators that I mentioned very early in this presentation, so they have been working with us very closely to support the development of StepUp. So, so we started building our StepUp, before we even actually offer our StepUp, we had to do a lot of, preparations. And, as I'll explain shortly, that this is about, asking people to volunteer to express their interest in dementia research. In doing that, we had to make sure that, people trust us and people are really understanding that, whatever the information they provide will be securely, stored in a place that, that no one else can access. So we worked with our legal team and, ICT team members and also a number of other departments in our university to really make sure that what we are offering to the public and to our researchers is something that, is trustworthy. So we spent a lot of time to actually develop, over 30 protocols. So last time, when we started this 2018, sometime March and April, we started the whole process. The development of the protocols you see right now, it took a minimum of 6 to 8 months to develop them. And that involved, a number of different committees and, the groups that provided input into the process. So now I just explained what StepUp for Dementia Research is. So it's an Australian-wide dementia research participation and public engagement platform. And it works by, having people, registering their, interests through online or help desk or post. So we make these options available. Anyone over 18 with or without dementia in Australia can register. And we ask for simple, the information about their demographics and, their age and, where they live, whether they have a diagnosis of dementia, if they have, what type of dementia, if they don't have, do they have concerns about memory problems and so on. So we ask those questions, and often it takes about 5 to 10 minutes, depending on their conditions, 5 to 10 minutes to finish. So then once they have registered and they are, put into this database, and when the researchers come to us with their ethically approved studies, and people can be matched. So, it's a kind of, our StepUp is a one-stop shop. People can come to us, both volunteers and researchers, and then we have a matching service that actually provides the support to researchers. So it's a fairly simple in terms of the overall process, and what we want to make sure is that people, researchers are doing any type of research are going to be supported by us. It's currently completely free service, and we support researchers doing treatment, prevention, care, or diagnosis. And you can see here there's so many different types of studies. So StepUp is not just here to support drug trials, or we're not just supporting surveys. We support any type of dementia research that is going to help us for our building our future. So if I just show you briefly, how it works from the volunteers. So people sign up by online, they come to our website, or they call us if they don't have, a computer, or if they don't have internet, or if they ring us, then we can send them a paper form, so that they can register. And once they register, they get email notification, or we do that over the phone. And then they can, their information is stored. And then they wait to be matched to a study. In the meantime, researchers come along and they actually sign up in our system, and we verify researchers, so that we make sure they are, people who are doing dementia research. And then we also then, look at their, study details. So studies must be ethically approved. And then we check that information and put information in our system. So researchers, may be wanting to do a study looking for people over 60 who live in Sydney Inner West, and they're looking for people, who don't have dementia. So we put that information in our database, and then once we are satisfied, we turn on the switch. And then when we turn on the switch, then there is this matching algorithm working behind. And then match can happen. When that match happens, then people get email notifications saying that you have been matched to a study. And then, the email says if you're interested in have a look at some more details about the study, they can have a look at the study details. And then they say, well, how much they're interested. And then they wait for the researchers to contact. And then for the researchers, when that matching happens, then they also get email. You've got 10, for example, people matched to your study. And then researchers can look at what the, volunteers, matched people have said about their interests, and then they can also contact volunteers. So this is the kind of, an overall process. And just to make sure that, you understand that researchers, who are able to contact people directly have to go through a number of steps. They create an account where we can verify their information. Their employer also has to sign data access agreement, so that, they are saying that, their staff members, researchers will act, behave ethically and appropriately. And the chief investigator then also signs consent, agreement, saying that I'll make sure my staff actually, act appropriately. And then they, create the study. But at the same time, we provide a training. It's a mandatory training that researchers have to go through. And then they also provide ethics documents. So there are so many steps that they have to go through to be able to, work with us. But the researchers so far, say that that's a really important part of the process, and they're happy to do that. So this is a very simplified version of what people actually get to see, what researchers get to see once people are matched. So this is, they get to see the ID of the person, and the gender, and the age, and the postcode. So it's de-identified information, and they can see whether someone has expressed a high or medium interest in their study. So and so this is what researchers get, and then they get to actually contact those volunteers directly, either by email or telephone or by post, depending on what the volunteer wishes. So what we want to say is that our StepUp for Dementia Research, our service is a free service for researchers to use. What we really emphasize is that we want to make sure that we protect the volunteers' privacy and confidentiality. And as I said earlier, that we had to go through a number of processes and also create protocols, and we follow those protocols. And also we want to make sure researchers don't over contact people, and so that we have an ethics approval from our university to make sure that people who are using our StepUp follow those the rules, and they understand the responsibilities as well. So this is how it works. Now we have also tried to make sure that our StepUp is known to other people. It's no use if we just create a service and no one knows about our existence. So we have a program called Ambassador Programs, and also we have a Champion Program. So currently, we have 4 ambassadors who have agreed to support us, Ita Batros and then Quentin Bryce and Kate Swapper, who is also a strong advocate for dementia in Australia, and Professor Graham Samuel. We have a public involvement panel consisting of consumers and the carers of people living with dementia, and research involvement panel, and who are researchers, doing dementia research, and project advisory board also, provide us overall direction of our program. So, as you can see that we have 22 champion organizations who have agreed to help us to promote the StepUp through their organizations, and we're very fortunate to have those champion organizations. And we are open to to work with more champion organizations. If any of the providers or organizations are interested in working with us, please get in touch with us. And we also delivered lots of presentations, and we believe we've reached about 2,500 people last year, and media coverage, and we went to memory clinics, and we've currently distributed over 7,000 brochures, and we also attended a number of forums. So this is what we did in 2019. So what happened was last year we built this, between 2018 and until 2019 September, we constantly built our platform, and we built initially the volunteer platform, and we had the launch in June, and we then created a matching service in September. So our service as a full service didn't start until October last year. And so far we have 112 researchers submitted registration form, 55 researcher account holders, and 31 researchers completed training. So these are the people who are using our StepUp service right now. So you can see that even if we started in New South Wales and WA, that there are researchers across Australia who are using our service, and currently 10 studies recruiting volunteers, and 2 studies having closed, and also as you can see that 9 organizations have agreed or assigned the data access agreement. This is probably most interesting part for you guys. So we have 900 account holders, and 711 people are actually, able to be matched. And as you can see, most of them are registered through online, and very small number of people register by a paper form. We have mandatory and non-mandatory questions, because we ask people certain questions that must be answered before they are able to be matched. But in almost 70% of them also finish the non-mandatory questions, which is really good. We designed the 2 steps because we didn't want to overload people with too long questions, because then that may not actually help our registration rates. And interestingly, 76% of our volunteers are female. And not surprisingly, most people are aged between 45, 64, or over 65. And New South Wales the highest currently, and we also have about 11% of our volunteers diagnosed for dementia or mild cognitive impairment. And this is probably most interesting part. Again, not surprising, 44% of them have a first-degree family history of dementia. So people are naturally interested because they have first-degree family history, and 17% of them have memory concerns. People mostly hear about us, through media and social media and internet, but also through dementia organizations. This is what we have done so far, and what we really want to, say to everyone is that StepUp for Dementia is about bringing hope. It's about contributing to finding cure, diagnosis, treatment, and improving care. And we also want to make sure that we contribute to reducing stigma in our society and helping patient and public involvement in dementia research. And also then, I guess we really want to improve our efficiency in our dementia research. And it's, we are the kind of ecosystem, opportunity enabler in our ecosystem. And that's a really important role that we play. And, in doing all of that, we want to actually save money in the end. Recruitment costs fortune. And, for a drug trial, someone said, it can cost $10,000 for one successful participant involved in a drug trial. So, that may be extreme in a particular style of, type of research, but nevertheless, recruitment is quite costly. And we hope to be able to, bring social and economic returns. And, our goals and ambitions: improve dementia recruitment efficiency, enhancing research output, more opportunity for knowledge translation. But I, really want to, make sure that we bring about sustainable and systemic change and improving our society's attitudes towards dementia. That's really important. And, ultimately we want to be, inform and guide the dementia services and research policy developments. And this is what, these are the things that we really want to, these are our face in a way, and we really want to make sure that we meet our goals and ambitions. I guess, how can you help us? I guess this is the part that we, I really want to emphasize. We don't exist in silo. We coexist with, within a number of, systems in a way. There are researchers, there are people in the community, there are people from the hospitals, from all fronts. We really want people to see the value of what we do, and to show that we want people to sign up today as a volunteer. And, I signed up myself, and I know a number of clinicians signed up, themselves as a volunteer, not necessarily as a researcher, because, they have a role in saying about the services, if there is any research looking for professionals, and also, anyone, even someone doesn't have anything to do with dementia. There are a lot of trials nowadays looking for, prevention trials, for example, and they're looking for people who don't necessarily have dementia diagnosis, and then they get in, get to experience, a number of new interventions that may help, prevent dementia in the future or reduce any risks associated with dementia. What we would like you to talk to your family, friends, and colleagues and neighbors about StepUp and help them sign up, and talk to your, clients and patients if you work in the hospital or healthcare settings. And we've had a number of clinicians actually ringing us or sending us email, and they say, we want to, let our patients know about StepUp. Can you send us some brochures? And we actually post the brochures to those clinicians. We have social media, Facebook, Twitter, and we also have our website, as you can see, www.stepupfordementiaresearch.org.au. And also, if your organization is interested in being a champion, we are looking for, champion organization champions as well. So this is the the final slide of my presentation. Thank you.
Thank you, Professor, for that presentation. We do have a couple of questions that have come through the collaborative. Daniel has asked, you mentioned the issues in recruitment being costly, time-consuming and challenging. How do you see those issues being overcome with the register?
So the reason these, the time-consuming and costly, one of the reasons is researchers are unable to reach out to those people who may be eligible for their study in an easy manner. So as a researcher, when I do a study looking for people with dementia in our community, I sometimes go out to public events, especially like a carers groups. I sometimes go and talk to GPs or aged care providers, but then reaching out to those people is really slow, and sometimes you may not necessarily get people right there and then. So whereas with the StepUp, I can register my study straight onto the system, and then there are already people with the kind of profile that I'm looking for in the system. So without StepUp, it may take 6 months for me to recruit 20 people for my study. You get to see people in the database straight away, so you may actually end up with 20 people on your first click. And then, of course, these people have to, listen to, the study details and then decide whether they want to participate or not. So it's almost like we have removed the middleman, and you go straight to the service, the StepUp service, and then you get to have these matching volunteers right in front of you, so that it removes a huge amount of time and money that would have been required if you didn't use StepUp. So that's one way of looking at it. Another way of saving the money is that because just using me as an example, if I was able to finish my study recruitment within 2 months, I can do other things, not just spending enormous amount of time looking for more volunteers for the next 6 months. And that, will help me to focus on the most important part of my study, which could be something about analyzing the data in a rigorous way, or I could actually come up with findings earlier than I actually anticipate, and that would allow me to do other studies or explore other research questions. If it was a PhD student or honors student, sometimes the students have only limited amount of time that they can finish. If they couldn't actually finish their recruitment in a timely manner, they may have to get further extension for their studies. That could actually cost a lot of money for the student. So the implications are really vary, and some are really tangible. So in our current study, that one of the researchers at University of New South Wales, and they were able to recruit people within two months. That they reached their target number within 2 months, thanks to StepUp. So, otherwise they could have taken months and months of time. So this is what I'm talking about in terms of saving costs and resources and time.
Thank you, Professor. The Global Community Resourcing and the Community Care Smart Assistive Technology Collaborative are very pleased to be signing up as champions, and we noted on your previous slide where people could go to get involved as champions. Are you able to just explain more about what the role of a champion is for those that are thinking about signing up?
Yeah, so the champion organizations, they don't sign up. So we want people, listening to this presentation today, we want people to sign up, come to our website and become a volunteer. For the organizations, we would like organizations to contact us. And basically the champion organizations work with us to promote StepUp through their own resources. So there is no monetary requirement. It's like organization volunteer, but in a way that is more, I guess it reaching out to a broader audience. So, in your organization, you have membership. You may have thousands of people in your membership. Therefore, when you circulate newsletter, your organization could actually feature StepUp. Not always about what StepUp is, but we also have on our website, we have a new news section. We regularly, kind of publish the latest research in dementia, and they're really interesting, results. So we share that information with our champion organizations, so they can actually put that in their newsletter. If they have their own events, then they can also talk about StepUp. And if they have social media, they can also, talk about StepUp through their social media. And we provide the content for those, avenues.
That's great. I just have one last comment from the collaborative from Mary. She said, I don't have a question, I just have a comment. I just wanted to say thank you for your presentations today. This is one of the best initiatives I've seen all year. I'm looking after my mother who has dementia at the moment. I can see a real benefit for carers of those who wants to be involved in research and the importance of that. And I just wanted to say thank you for doing this. Thank you, Mary, for those comments. And thank you, Professor, for your time today in presenting to the Community Care Smart Assistive Technology Collaborative. If you haven't already done so, please go online and register for the collaborative. You'll be able to access today's presentation and have the opportunity to ask further questions. Please check the collaborative for more information on upcoming events. If you have any further questions or inquiries, please email us at sat@communityresourcing.com.au. Thank you, Professor, for your time today.
Thank you.